Well, we're here today with Katrina Sanders, RDH, who is a member of our Modern Hygienist Editorial Advisory Board. Katrina, thanks so much for joining us.
Well, thank you so much for having me.
So we wanted to talk about the impact of this pandemic on dental hygienists. And I guess to just start, can you tell me a little bit about what the last month or so has been like for you personally?
So personally, this has been a crazy month. I had decided my birthday was actually in March. Friday the 13th was my birthday. And so I decided this year that I was going to treat myself to a trip to Europe. So I was in the south of France celebrating my birthday when I got a phone call from my family. I got emails, text messages. I mean, it was just, my phone was exploding. It was about 2 o'clock in the morning in the south of France. And everyone was panicking, saying, you need to get back into the United States. Nobody in Europe had seen what our president had put out. Nobody in Europe knew about this travel ban. But when I received all this information, that was the first, you need to get back to the United States. We didn't know details about how people would be getting back to the United States if they were in Europe. And so that was the start for me of this this social distancing, this movement into, okay, things are going to be different. I returned to the United States after an extremely long 23 hours of trying to get back from the south of France on a very expensive last-minute flight that I booked for myself. And when I got back into the United States, I was shocked to see that people were buying up toilet paper, all of these things, because it seemed like when I left for Europe, things were normal. Things were what we knew to be true. I got back from Europe and it was just completely different. I was walking through the grocery store aisles and was shocked to see empty shelving units, seeing all of these. And I think we can all agree that over the past couple of days into weeks and now months, we're seeing an evolution of how the public is interpreting infection control, how stores are instituting rules and guidelines. So that was very eye-opening for me. But as you can imagine, I had actually self-quarantined in my return from Europe. And so I spent the first 14 days back from Europe, including my birthday, in isolation. And then now we're starting to see that has now become a bit of a trend. So I've been isolating a bit longer, I think, than most. And I'm definitely, from a personal standpoint, between you and I and everyone watching, I'm grateful for the time to be home because I do spend a lot of time traveling. I'm on the speaking circuit. And so I'm one of those people that never fully unpacks her suitcase, but I've unpacked my suitcase. My dogs are very confused because I've been home for a very long time now. I've learned to manage without getting a mani-pedi, the whole thing that I think the rest of the community has experienced. And I think along with that as well, I've learned the wants versus the needs, that at the end of the day, there's so many things that I truly am grateful for. I do have a full pantry. I do have food in my refrigerator. I have my health. My family has their health. I'm still working. I have a purpose. And at the end of the day, those are the things that really matter most. So I will say it's been a very eye-opening experience for me, to say the least.
Well, I appreciate you sharing that with us. Obviously, we're all kind of having our own versions of similar things play out with experiences in stores and that sort of thing. But you mentioned, I'm obviously still working because I'm talking with you, that you're able to still work, but a lot of your colleagues in the dental hygiene community are not. We've seen, most dental practices are shut to everything but emergencies. So almost, a percentage are completely shut. And if they're shut to just everything but emergencies, there's not really any hygiene appointments that fall under emergency for the most part. So what is happening and what are you hearing from hygienists? What are they doing right now?
Yeah, so hygienists, we're seeing two sides of the coin with hygienists. And I'm very proud of our association for doing the things that they're doing to try to wrap their arms around the hygiene community and provide some leadership and a voice of reason. I've been in constant communication with Matt Crispin, who is the president of the American Dental Hygienists Association. What a time to be the president of the ADHA. Holy cow. And he is just really working to try and kind of bring some unity to the hygiene community. So I will say there are two sides to the coin. One, we have the group of hygienists who immediately, when COVID-19 really became the concern that it is now. I think we'd all heard about COVID-19 at December. We heard about January, February-ish, middle of March. 3 days before my birthday, that was when it was like, wow, what is going on? And so ironically, many of us had been practicing knowing full well that COVID-19 was there. It was a risk. We kind of associated it with the influenza, and so as we began to learn more, there was a large portion or a large population of hygienists that really took this and created a concern around it, understandably so. We are individuals who learn so much about infection control. We have course content on it. We have to take continuing education coursework on it. And so we understand this so intimately. Because of that, we immediately, many of us, started to sign petitions asking our state governors to classify the work that we do as non-essential. And I think about that, and this is just kind of from my end as a thought leader. I saw that and I didn't immediately step onto that bandwagon. I understand why hygienists were there and why they were concerned. I did not want to place the hygiene industry in a position where we were classified by our government as considered non-essential. In my opinion, when we take a look, particularly at what we know to be true about COVID-19, we're looking at COVID-19 and we're linking it to the 1918 Spanish flu. We're understanding that there are a lot of similarities between the two. And so we're studying the things that we learned about the Spanish flu, and we're using that to help guide how we approach COVID-19. Well, what we found with regards to Spanish flu and additionally COVID-19 is that people who are at elevated risk for contracting this, we know the spread of infection, we understand all that, but the people who are at elevated risk for acquiring the virus and then getting extremely ill from it, or even, losing their life to it, those are people who have risk factors, which the hygiene community, we know risk factors. We study that. We integrate that as our part of our clinical decision-making process. So we know that to be true. And one of the biggest risk factors we're seeing is this concept of cytokine storm syndrome, which is a fancy term for when a patient is in a constant state of inflammation. And so the body is releasing those inflammatory markers called cytokines. Well, what's a chronic inflammatory process that's extremely common, extremely prevalent across the United States, that can cause these inflammatory cytokines to be present? Perio. Yeah. So there's half of us, and there's a large portion of hygienists that say, let's classify hygienists as non-essential. And I think we were doing that. I say we because I'm a part of the hygiene community. I think we were doing that because we were scared, because we were concerned about our infection control. We were concerned about our safety, rightfully so. And we were scared that the pieces that, or rather the aerosols that we could produce during our work created a risk to our colleagues and created a risk to the patient in the chair as well as other patients. We just didn't have enough information when that moment happened. I think we can all agree the CDC, OSHA, OSAP, all of these entities are still trying to gather information, trying to do research. And so we just didn't know how safe or unsafe it would be for us to do the work we did. So I completely understand that. But what happened was we classified ourselves in nearly every state as a non-essential provider. And now we're in this state where there's another side of that coin, where you have another group of hygienists saying, I don't understand why we're considered non-essential. I think we need to be classified as high risk. Absolutely. And I actually have here, this has been shared across communities. There's a post that was done that indicated a COVID-19 risk based on the industry. So they have on here, for example, dermatologists, OBGYN, sports medicine physicians, respiratory therapists, and they are scoring these different industries based on their risk of propagating or acquiring COVID-19. And wouldn't you know it, dental hygienist is at the top of that list. We are the tippy top, 99.7% risk of COVID-19. So it makes sense. We understand that. We're wrapping our minds around it. But now we're in this state where we've just signed a bunch of paperwork and the government has acknowledged that we're non-essential. Although we recognize and acknowledge that we have the skills to be an essential part of this. In addition, just this week, the ADHA has released some information with regards to the dental hygiene students. You see these dental hygiene students most of them have not taken their clinical boards exam and or their written boards exam. And so the ADHA released some information about the boards examination, and wouldn't you know it, the educators are really grateful for that information. Most practicing hygienists who had to take their clinical and national boards are upset because what's happened really is the states have been given the authority to decide if these senior dental hygiene students need to take their boards exam in order to gain their licensure, or if there will be a pass of that this year. So now the hygiene community, many of them are not wrapping their arms around that decision. So that's adding certainly another layer to the dental hygiene community. And so there's a big divide, if you will, about us understanding our role in all of this now, trying to understand if we want to embrace these senior dental hygiene students who are now stepping out into the community and may or may not be required to take the same amount or numbers of examinations that the rest of us were required to take. And so we're really in a state of disarray, and working daily to find a common ground and to be able to work through that together.
Mm-hmm. In terms of that state of disarray, how does employment fall in all of this? I know from numbers that the ADA has been putting out on a weekly basis that a good percentage of practices tried to keep their full staffs on the payroll after 1 week, and that percentage dropped after 2 weeks, and it's continuing to drop. Are most hygienists currently just unemployed and on that massive list of people filing for unemployment lately?
I would say yes, to answer your question. I don't have statistics on that, but just based on my working knowledge of the industry right now, I would say most hygienists are either furloughed, completely not working, were let go from their job. I mean, there's some hygienists out there that just said, my doctor let me go. And I don't currently have a job. And so who's going to be applying for work right now and, trying to get a job. And so when all of this lifts, I don't have a place to go. The other side of that is we're seeing doctors posting on social media saying, this is the end of hygiene, that, why would you keep a hygienist on staff? There's a lot of expectation out there that what's occurring right now is going to mimic in many ways the crash that happened economically in 2008, 2009, where doctors really are believing that this is kind of the end of hygiene. On the other side of that, I still work with clients as a consultant, and I actually have several clients who believe the exact opposite. They believe now more than ever, this is the time when hygienists are going to be extremely impactful and extremely important for many reasons. Number one, there are hygienists who, while they are not working and treating patients right now, there are many states that are bringing hygienists in as volunteers in the front line of triaging at hospitals, which I just got goosebumps even saying that out loud, Noah, because For so long, we have worked to create this marriage, if you will, between the medical and dental communities. We've been trying to pull up a seat to that table and sit down for forever, and we haven't been able to do it. And I think now, with us being in the same building and utilizing our clinical savvy, utilizing the things that we know about screening patients, patient communication, bedside manner, empathy, I mean, all of those things, what a beautiful thing. So I do want to do a shout out to the hygienists who are still on that front line, are in those hospitals, are gowning up, and are using their skills to really help not only support the community, but further our industry. Like, good for you. That's amazing that that's happening. But in addition, a lot of doctors acknowledge that I think this is almost like a dam of water kind of building up. I joke, but I desperately need a mani-pedi. They're the people who do nails, the people who do hair, who do eyebrow waxing. Like, it is going to be insane once all of this releases, because those are service-based industries. I believe, and many dentists believe, that hygiene services will be absolutely the same way. And to kind of create a nod back to what we were talking about with regards to cytokine storm syndrome, I believe now more than ever, we need to look at what this whole non-essential business has done to dental hygienists. I hate to say it, did we do this to ourselves? Did we provide doctors, dentists, the community with this perception that we are non-essential, and so you don't need to hire us, you don't need us on your team? I don't know. But I think now more than ever, we need to band together, and we need to create this understanding that the work that we do as inflammatory specialists is extremely important and impactful. This is the time when we need to build value in the service that we not only can provide to the practice from a production boosting standpoint. Even in 2008, 2009, when the economy crashed, patients were still coming in for their routine visits. Patients that were employed knew that they were still getting their, hygiene visit, their radiographs, their examination covered by their dental insurance. They were still coming in and maintaining that. And so we need to look to that. We need to look to the fact that this is not just an economic concern, but this is a health concern, that we now have a community who is at least mildly educated on infection control, the spread of infection, disease, risk factors, who is at risk, and how we need to treat and address those. And so as a hygienist, I'm excited. You mentioned earlier, my work, albeit I'm not standing on a stage and delivering content that way, but my work has completely shifted. I'm working around the clock, building new content out, because I do believe that this is where dentistry is going. This is going to be the explosion that we need to see in dentistry. And so, to your point, yes, there are a lot of hygienists that are furloughed, are filing for unemployment, are scared. I implore those hygienists to consider that this is your opportunity. And so how can we take what it is that we know and build value in that? And so I've counseled hygienists on what would a doctor want? Once things are ready, when we're ready to turn the lights back on and get our Cavitron units working again, what would a doctor want? A doctor would want a hygienist coming in and saying, we need to revamp the infection control policy. And I've done that. Here's a manual that I've put together on that. I've done the research on high-speed evacuation systems. I've done the research on pre-procedural mouth rinses. I've done the research on this. I've done, and this is the inflammatory protocol that I would like to build out for this practice, because it's important for us to be able to treat that inflammation in our patients. It's important that we educate our patients. Here are some forms that I put together on screening patients that are at elevated risk for COVID-19 or other flu symptoms. Doctors are going to want hygienists to take the lead on that. And so during your downtime, when you are, scared, you're concerned, this is your time to build it, put it together so that it's in this gorgeous little package, and you can hand it to your potential new employer and say, this is what I'm ready to do for you.
Mm-hmm. And now you've touched on a couple of things that I want to get to here. And, a lot of them have to do with, as we do come out of the shelter in place orders and we get back to what would be regular business, there's going to be differences in protocol. And it seems to me that many practices have delegated infection control to one or more hygienists. These are, areas where hygienists have expertise more so than some medical doctors in terms of personal protective equipment. And when I see my doctor for a physical, he's using a lot less protection than my hygienist when I go in for my prophy appointment. So there's skills and knowledge already there. You kind of touched on this. Is this an area where hygiene needs to take the lead as changes come into practices for improved asepsis protocols, improved cross-contamination prevention strategies? And do you have any thoughts on what those might be?
Oh my God. Yeah. So many thoughts. This is what I do. I just pour myself a glass of wine and I think about infection control. And I really do. Anybody who knows me knows I'm like a major nerd and I really do think about these things. So here's the dirty little secret in dentistry. And by dirty, I do mean dirty. We have known for a long time that the things that we've been doing from an infection control standpoint, most of us in our practices, we have acknowledged that it's not okay. And I see it on social media. Hygienists will say, my doctor gave me one mask for the whole day. Is that right? We learned that in school that that's not right if you have the supplies for it. Obviously, we are in a global situation where people are doing the best they can with what they have. But prior to all of this, when we did have full access to level 3 masks, when we had full access to purchasing high-speed evacuation systems, when we knew that patients needed pre-procedural mouth rinses before we generated aerosols, we knew these things. But dirty little secret, most of us weren't doing them. There's a chasm, in my opinion, or a line that we cross between this is what we learned in school, and then this is the real life. This is how we do things in this office, or this is how we do things in this practice. And I'll tell you, Noah, I travel. I have a program that I deliver on infection control. It's titled something like when you absolutely don't want to go viral. So I deliver it because, as you know, we have to do infection control CEs in order to renew our license in most states, if not all. And so I deliver this content. People come to it because they have to. But what we do when I start unpacking these things is we start talking about some of the things that are not right in the dental operatory that need to change. And I have hygienists come up to me afterwards or slide into my DMs or email me saying, I hear you, I hear those things, but my doctor won't do them. I've approached my doctor about it. How do I have this conversation with my doctor? How do I talk to my doctor about it? Or I get the other side of that. And this does occur in many states where the hygienists say, yes, I'm trained in infection control, but it's the lead assistant in the practice who does the ordering, does the biological monitoring, establishes those protocols. I'll even see things on social media like Facebook and LinkedIn where hygienists will say, my lead assistant says that this is how it has to be. And with all due respect, I think our assistants are amazing. I'm honored to work for an incredible periodontal practice here in Arizona where our assistants are highly trained and they really know infection control forward and backward. But in many states, assistants are not required to go to assisting school. In many states, assistants are not required to be certified or registered. And Arizona happens to be one of those states. And so with all due respect, when we talk about who is establishing this protocol, I think it's been very messy for a long time, pun intended. It's been a mess from so many different angles. And so to your point, hygienists are highly trained on it. Most doctors want to make sure that they're providing the things that they need to for patients to be safe. Most doctors oftentimes rely on their hygienist as the other provider in the practice to help them with those things. And it does hurt my heart when I hear hygienists, my esteemed colleagues, say, I'm telling my doctor and my doctor's not listening. I think we're entering a new age, a new culture. The doctors are going to have to listen because patients, and we see them on social media all the time, these photos of patients with their creative, people out in the community with creative ways that they've integrated their own infection control, whatever it is that they're doing, whatever contraption they've, creatively put together to help protect them. The reality is that we have a community who now is extremely knowledgeable, concerned, aware of infection control. You think these people are not going to sit in your chair and ask you, are those instruments sterile? Is this safe? Is this, what protocols are you taking to protect me? I think now more than ever, this is the call to action that dentistry needs. And it will be a culture shift for us. The practices who acknowledge that are already taking the steps to research what those things look like. And I've certainly built out my own thought leadership pieces on where I think this is going. I believe that there are many steps to this. I believe the first thing that we all started to panic about was protective personal equipment, or PPE. But that's just one layer to all of this. Yes, we need to look at what OSHA, CDC, ADA, OSAP, what those guidelines are saying. And I think we need to be mindful of ensuring that we have the right PPE, we're using it the right way. We need to look at how we're laundering our scrubs, how what outerwear we're wearing, even our shoes. All of us that went to dental and dental hygiene school, we had clinic shoes that we had to wear, and they were different than the shoes that we wore out on the street. We need to go back to those things. Hair nets or surgical caps, taking a look at what we're wearing on our face to protect ourselves. And we also need to look at the patient, how we are protecting the patient. Their mucosal membranes are so incredibly exposed. And we know that those mucosal membranes are where we're seeing COVID-19 enter. So protecting their eyes with protective eyewear. The offices that I'm consulting with are even getting earplugs to protect the ear. Even talking about nasal swabs with xylitol, or potentially talking to the patient about, I don't know, using a nasal spray, doing a pre-procedural mouth rinse to protect the patient, using high-speed evacuation systems for the things within the practice that really elevate the risk for aerosol contraction, like using our magnetostrictive piezoelectric hand pieces on the hygiene side, doctor using his or her high-speed hand piece. So those are things that we need to do, but then also screening patients. I think for the most part, when we talk about health history, we've done a relatively cursory exam when it comes to screening the health history. I'm looking at that health history. Am I going to kill you, or are you going to kill me? That's what I want to know. Do you need a pre-med? Do you have some type of an infection? So we need to go back to even screening our patients. We need to go back to identifying if this is a patient that is elevated risk by looking at their age, comorbidities, looking at if they do have an inflammatory condition, if they've traveled to a hot spot where they've maybe, been exposed to COVID-19, if they've experienced symptoms or been in the same room as somebody who's been symptomatic. But even before that, looking at what it is that we're doing from an operations standpoint. So many hygienists say, my front office, will come back and they'll say, your 10 o'clock patient tried to cancel because they weren't feeling well. Don't worry, I convinced them to still come in. Why has that ever been okay? And on top of that, how many hygienists out there, I'm raising my hand included, have gone to work maybe not feeling very well and potentially exposed your coworkers or other patients? So this needs to be threaded all the way through. It's not just PPE. It's not just our evacuation systems. It's not just getting air purifiers in the office to clean the air. It's not just the things the patient needs to do. It's not just screening the patient. It's not just operations. It's everything that comes together and has to wrap around the way that we integrate that care for our patients so that we are being comprehensively protective of ourselves, our staff, our patient in the chair, and our future patients who are going to be walking into that operatory.
I think that all makes a lot of sense. And we definitely, we're going to see a different look to how patients are managed when they come in. We're going to see different procedures. And I think you hit on a lot of the things I'm hearing when I talk to people about things like wearing surgical caps, things like pre-procedural rinses, everything that you can do to lower the risk to both the patient and the clinician. And I think you hit on that really nicely, how the importance that it's health of both parties there, not just the patient.
Yeah,
and,
absolutely.
But with this large pool of very talented people with expertise on these areas of healthcare specifically, we've talked about inflammation, we've talked about infection control, personal protective equipment use, and all those things. How do we get their voices out there now while they're not able to see patients, and to make sure that these things you addressed and that full circuit of changes happens, and we go back to work in a good way?
Yeah. What a fabulous question, Noah. So this goes to what I call societal trust, which is one of the codes of ethics that we take a look at as clinicians. When we look at societal trust and community trust in the work that we do, there are two sides to the coin. The first is, how do we get our coworkers and our doctors, potential employers, whether that's a large DSO, large corporation, a school maybe, how do we get them to hear our voices? And there's so many ways that we can do that. I think the first thing is, we need to do better on social media. We as hygienists, and I don't see this in other industries. I don't see nurses doing this. I don't see doctors doing it. But as hygienists, we attack each other. Somebody posts a photo of, subgingival calculus and says, "I'm struggling to remove it." And you've got some hygienists saying, "Hey girl, I get it. Have you tried this? Have you tried that?" And then you get other people that say, "You need to take a scaling class," and just are attacking each other. And so we need to support each other. We need to create a united front where our doctors, other colleagues, our assistants are seeing that we are working together. And there are so many incredible influencers out there who are doing that. They are creating COVID-19 recovery groups on social media, providing opportunities for people to ask questions, providing resources. There are entities out there that are doing free webinars to bring the dental community together. This is no longer a competition. It's no longer, I want to market to more patients than the office across the street, so how can I do that? We're past that. Dentistry needs to come together. We need to have a united front in that way. And so I think that's the first thing. In addition, I do believe that doctors want to rely on us for our expertise. They do. They want to trust us. So I'll give you an example. I worked in a practice for a very long time where I would do all the anesthesia for the doctor. I didn't do any hygiene services. All I did was anesthesia. And this particular doctor was a doctor who liked to run the show. And he was that way with everybody except me. And I realized it's because when I would approach him and I would anesthetize a patient, for example, I would say, "Doctor, the patient in operatory 2 who you're doing a crown on, that particular patient has primary biliary cirrhosis. So what I would like to do is utilize 4% articaine, because that's metabolized in the plasma cholinesterase instead of the liver. And I would like to deliver half the concentration because I've researched it. And that's what most research is saying, is to use half the concentration that I would typically use for that injection. Is that something that you're comfortable with today?" You think the doctor is going to say no? No, what he does is he respects me because I've come to him with the information and I've said, this is what I'd like to do. I'm going to collaborate with you. I'm not here to rule the roost. I'm here to have a dialogue with you about it. And are you comfortable with that? Well, he and I got to the point where he'd just say, "Katrina, just do whatever you want," because he knew that what I was doing was very patient forward. It was safe. I would come to him if it was something that was of a concern. And so hygienists, how can we do that? How can we be that voice of reason? How can we approach doctors with this plan? How can we organize our thoughts? How can we gather all the information? There's so many resources out right now. Everybody's doing webinars for free. The ADHA is doing webinars for free. Everybody's creating this content. How can you take your beautiful time that you have while you're waiting to treat patients again, gather all this information, create something that's going to be very meaningful and supportive for the doctor? On the other side of the coin, societal trust from the community. How can you build trust from your patients? And so one of the ways that I'm doing that, for example, is I've built out some pieces. We realize that as medical and dental providers that we have a lot of training in infection control. And our patients, the community, they're out there trying to interpret the things that we already know. And of course it's funny and it's lighthearted, but then it makes me sad because I think about, like, I had a conversation with my dad the other day, and he was asking me about how he wears his mask and how he should launder it and all these things. And I realized the community doesn't know these things. Who are the patient advocates? Who is out there advocating and supporting, for optimized success for our patients? That's us. And so there are absolutely ways that we can use social media. There are ways that we can use the reach and the power that we have to be that voice of reason, to be supportive, and to be kind to our patients.
Mhm. Well, wonderful. Well, Katrina, I really appreciate you taking the time today to share your experiences and your expertise with us. I'm looking forward to coming out of this and seeing hygienists own their expertise all the more so and continue to provide great care for people. So,
Absolutely. I couldn't agree more. So everybody stay strong, be safe, be well, and sharpen those skills, because it's going to be just a matter of minutes before we're back out there and changing the game forever.
wonderful. Well, thank you so much.
Thank you.